You have been watching the confirmation hearings for Robert F. Kennedy Jr., who is President Trump's nominee to be the Secretary of Health and Human Services. We're about 3/4 of the way through the hearing, but they're going to be taking a short break. So let's bring in CBS News medical contributor Dr. Céline Gounder, who is also editor-at-large for public health at KFF Health News. Dr. Gounder, so great to see you and great to have you with us. I know you've been watching this hearing unfold as well. Obviously, one of the big things that RFK Jr. has been asked about again and again over the course of this hearing is his position, his shifting position on the safety and efficacy of vaccines. Tell me what you heard and what stood out to you.
Well, it really stood out to me that he said, and I quote, "I am supportive of vaccines," because he has also said in the past that no vaccine is safe and effective. So this really represents shifting opinions on this very issue. He has also had his children fully vaccinated. He has said that he now regrets that decision. And he also said that he would not make it more difficult for people to get vaccinated or would discourage vaccination. But I think it's important to understand that in the role of HHS Secretary, there are multiple ways in which he could have that very impact. So one is just the power of the bully pulpit, calling into question whether vaccines are safe, whether there is a link with autism, which, to be very clear, that has been thoroughly debunked. Specifically with respect to the CDC, there are advisory committees of external experts that help advise the CDC on whether a vaccine should be rolled out, to what populations, what the schedule should be, those kinds of recommendations. And if he were to put people who were skeptical of vaccines on those committees, you might have less strong, less scientifically based recommendations. And those recommendations matter because they determine what insurance companies will cover. So even a slight change in language from should get vaccinated to may get vaccinated could have a big impact on whether various insurance companies would cover that. And we know when there's a cost to whatever the kind of health care is, there are some people who will not receive it. In terms of the FDA, he has petitioned to revoke the approvals for a number of different vaccines, ranging from polio to COVID. And so, there's real questions about what would he actually do if he had oversight over the FDA as HHS Secretary. He could certainly also make it harder for vaccines to get approved. And he called for the withdrawal of the emergency use authorizations on the COVID vaccines during the pandemic. If we were to have another pandemic, would we be able to get vaccines out in time to people with those kinds of emergency authorizations? That is really in question.
Céline, one of the fascinating things about this hearing has been that RFK Jr. keeps insisting, I am not anti-vaccine, I am not anti-vaccine, I vaccinated my own kids. And yet, Democratic senators keep reading quotes to him from his books or his speeches or interviews where he has said the exact opposite. And we also learned over the course of this hearing that he's getting paid millions of dollars to sign people up to sue vaccine manufacturers, and that the organization that he led until just last year has been and still is selling onesies on their website that have anti-vax messages on them. Would you say that it is his vaccine position or his variety of vaccine positions in particular that has led to the concern of doctors and medical experts about his nomination to this particular position?
It's not the only concern, but it's a really big one, and particularly in the aftermath of the COVID pandemic, where we've seen increasing resistance to vaccination, and not just with respect to COVID vaccines, but to other vaccines. We've seen a drop in a number of different childhood vaccinations. We've seen whooping cough outbreaks. We've seen measles cases. And so there's a very real public health impact of these drops in vaccination rates. And you don't need, you're seeing on that graph, 96 down to 92%, that you don't need a huge drop to start to see outbreaks of disease.
Right, because herd immunity is so important. Dr. Céline Gounder, please stand by because I want to go to congressional correspondent Caitlin Huey-Burns, who is on Capitol Hill and has been watching this entire hearing unfold. Caitlin, another big issue that has come up repeatedly at this hearing is the abortion drug mifepristone, and whether RFK Jr. as HHS Secretary would be willing to call for more studies about whether that drug is safe. Why has that been such a big focus of inquiry, this one particular drug?
Yeah, Nancy, it's been fascinating because this has been a line from Democrats trying to push him on where he stands here, because as HHS Secretary, he would oversee the FDA. And it was notable in this hearing, he said that President Trump has asked him directly to look into the safety of the abortion medication mifepristone, which is used widely in most abortions. And the question that is surrounding this is what the president himself would do in terms of restricting access or not. Back over the summer, when I interviewed President Trump, I asked him if he wanted to restrict abortion medication by mail, and he said no. But you heard RFK Jr. there say that the president has tasked him to look into the safety of this medication. He also said that Trump has not made a decision on where he stands here. So that was notable. And when you're talking about the safety of this medication, the FDA has rendered this a safe medication. So this begs the question of what kinds of studies would be conducted, what RFK Jr. would like to see. But this is a line of questioning from the Democratic side of the aisle, in addition to the questions about vaccine, given that this is a widely used medication. And the president himself had said before that he doesn't want to restrict access. Now, that could change, of course. It was also notable, Nancy, in this conversation about Title X or federal funding for family planning, and the president in an executive order reversed that. That was also something that was cheered by Republicans on this panel. Bottom line, it seems like this is going to be a committee line vote. Republicans seem more inclined to RFK Jr. with no Democrats seeming to support him.
Right, Republicans have certainly been very cordial, despite the fact that as a former Democrat, he does not always see eye to eye with them on the issue of abortion.